Hello and welcome to Conspiracy Boulder.
You're not a boulder, you're a rock!
Welcome to Conspiracy Boulder News. Reporter Greg Borden, who writes for McClatchy DC, broke a story on July the 21st, 2015, that was largely ignored by the old-fashioned media. According to Gordon, he discovered that in 2011, the FDA wrote up a proposal telling dentists not to use mercury fillings in the cavities of children under 6, pregnant or nursing women, and all people with allergies to mercury, kidney disease, or neurological problems. Here's the kicker. Shockingly, the FDA also urged dentists to avoid, where possible, in all patients, any fillings containing mercury compounds. Think about it. Never heard of this deadly serious warning? Well, no one has heard either. Wonder why? Gordon uncovered that someone at the Department of Health and Human Services secretly rejected the proposal after a reported cost-benefits analysis. We wonder exactly what costs were weighed against exactly what benefits. Think about it. Profits would evaporate. Class action lawsuits would explode. Since mercury fillings are the most common and the cheapest, this could have opened a Pandora's box. Would Obamacare have to foot the bill for more costly alternatives that wouldn't harm people? Imagine the staggering costs involved in correcting this mess to save people's health. Maybe it was deemed too expensive. And the Obama administration has been, quote, in the awkward position of concealing, for over 3 years, a safety communication, potentially affecting millions of Americans. End quote. Unbelievable. It gets much worse. Mercury is often disguised with terms like dental amalgams, encapsulated, and the safe-sounding silver filling. Gordon lists the dangers of exposure to even small amounts of mercury, like the amount in dental fillings, and lists many examples of people suffering a variety of diseases and illnesses tied to their so-called silver fillings that contained mercury. Gordon also reported that a 2011 risk assessment estimated that the number of Americans exposed to unsafe levels of mercury is 122 million, likely from dental fillings. Could it get worse? Oh yes. Oh very yes. Oh hell yes. The founder of one scientific lab said he thinks that up to 10% of people that have fillings containing mercury, quote, may be sick and many don't realize why. End quote. He also estimated that 20% of people with mercury fillings are suffering from weakened immune systems, one of the side effects of mercury exposure. 122 million Americans were exposed. 20% of people with mercury fillings are having their immune systems ruined, and not a peep from the old-fashioned media. Well, of course, it will come as no surprise to Conspiracy Boulder News viewers that the American Dental Association donates millions to congressional candidates and claims that mercury fillings are safe. Yet in the 1950s, mercury in wastewater contaminated fish near Japan's Minamata Bay, and when the locals ate the fish, 1,700 died. Because of the dangers of mercury, in 2013, 140 nations including the US signed the Minamata Treaty, halting emissions and disposal of mercury. Oh my living God! 1,700 people died from eating mercury-poisoned fish, and dentists are sticking mercury time bombs into our heads. And they say it's safe. And the FDA tries to put out a warning, and then someone deep sixes it. Oh my living God! So sit there, fellow Americans, and lament about Hollywood's latest breakup, or what athlete took what drug, or what rich millionaire will be our next president. And be secure in the knowledge that even when the government knows about something potentially very, very harmful to your health, they won't rock your boat. And the old-fashioned media won't scare you either. They'll just ignore it. Drift away, Sheeple Sheeple. Conspiracy Boulder News will continue after this break.